Welcome everyone to today's webinar, Using Payor Collections to Jumpstart Your Revenue Cycle in 2020. I am Angie Stewart with Becker's ASC Review. We'll begin today's webinar with a presentation and we'll have time after the presentation for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is my pleasure to start today's webinar by introducing our presenters. John Bardis serves as CollectRx's Chief Executive Officer. Mr. Bardis is a veteran in the field of healthcare and information technology. As president of Dr. First and executive vice president of Chromatics, Mr. Bardis has specialized in providing cost containment services to health insurers and various products and services to hospitals, health systems, and other healthcare providers. Previously, Mr. Bardis was an attorney at Kirkpatrick & Lockhart, now K&L Gates, where his practice focused on litigation. Mr. Bardis's clients have included a wide range of for-profit and not-for-profit health insurers, including Blue Cross Blue Shield of Florida, Humana, Capital Blue Cross, Kaiser Permanente of the Mid-Atlantic region, Care First, and Blue Cross Blue Shield of Massachusetts. Mr. Bardis has also worked on behalf of numerous hospitals and health systems, including Henry Ford Health System and MedStar Health, along with hundreds of physician practices. Pat O'Connor serves as CollectRx's Vice President of Business Development, having joined CollectRx in 2013. Mr. O'Connor has worked in operations management and analysis for over 10 years. Prior to coming to CollectRx, Mr. O'Connor worked as an operations analyst dedicated to process improvement, cost containment, and staffing solutions for a large national legal process outsourcing company. His unique ability to analyze and quantify data and put it into a client's perspective makes him a great fit at CollectRx. During his tenure, he has managed the operations team in developing complex process workflows, team building, and client reporting initiatives, all aimed at improving the revenue cycle and increasing the efficiency and productivity of CollectRx. At this time, I am pleased to turn the floor over to John and Pat to begin today's presentation.
Hello, everyone, and hello, Angie. Thank you for the great introduction. We appreciate folks taking the time to meet with us today. Again, I'm John Bardis, CEO of CollectRx, and I am joined by Pat O'Connor, who heads up our business development group. And the webinar we're going to present today is using Payor Collections to jumpstart your revenue in 2020. And we're excited to speak with you today about how Payor Collections and AR follow-up can jumpstart the following year. From best practices to trends in automation, we're going to talk about what you can do to make sure that you're maximizing your collections from payers for both in and out of network claims. More specifically, I'm going to be talking about current reimbursement and payer trends, the state of patient collections, best practices, maximizing payer reimbursements both in network and out of network, and how to implement a payer reimbursement program that leverages technology and expertise that can dramatically impact the financial side of your business. Before I dive into these topics, though, let me spend a minute or two talking about our experience in the payer reimbursement and in and out of network claims. It'll give you a better idea of why we're in a position to discuss these issues. So despite our name, CollectRx has nothing to do with the pharmaceutical industry. Simply put, what we do here at CollectRx is we help providers get higher reimbursements on in and out of network bills and maximize payer collections. We do this not as consultants, but as experts in negotiating and appealing claims in order to maximize reimbursements on bills and collections. We've been singularly focused on doing this for the last 10 or 15 years. Since 2006, we've helped more than 2,000 providers nationwide improve their reimbursement levels And we've done it for a variety of different types of provider groups, including surgery centers, physicians, hospitals, labs, really a variety of different types of providers. And there are really two sort of key things that help us as we get these higher reimbursements for our customers. First is what we call CRIXIS, which stands for CollectRx Information System. And what this does is this gives us a proprietary data and analytics tool that we need to go head-to-head with the payers. So CRIXIS helps us analyze insurance policies, helps us make comparable data between the payer and the providers, and we use all that to get the best results for our customers. And the second sort of key to our success, in addition to CRIXIS, is we rely on our expertise. We've built a team of people who are experts, having worked previously at the insurance companies and their vendors, and that puts us in a unique position to understand the soft spots of the payers and leverage those soft spots to, again, get them more money in the door. Okay, so with that as background, let me go ahead and sort of dive in here. And the first thing I'd like to talk about is trends in patient collections. The Department of Labor estimates that 1 in 7 claims is rejected, or the equivalent of 200 million denials every day. There are many reasons for this, but at the end of the day, providers and patients really are left holding the bag, so to speak, up to 14% of claims. Second is Medicare Advantage plans. Appealing those cases can generate a lot of revenue for you. Only 1% of denials are appealed, but of those that are, 75% are successful. Similarly, with ACA plans, with almost 1 in 5 claims denied, only 200,000 or 1 in 43 million denials ever get appealed. The ASC marketplace plans an average of 1 in 5 in-network claims in 2007, which denials range from 1% to more than 4% across insurers. And in a Change Healthcare analysis, it shows that of the estimated $3 billion in claims submitted by hospitals in 2016, an estimated 9% of those charges were initially denied. And even though the same data shows that 63% of denied charges were recoverable on average, representing $62 billion in revenue, it may cost hospitals and health systems nearly $9 billion more in administrative costs to recover that money. So reasons for not appealing: the complexity of the appeals process. It's expensive. Denied claims can cost significant dollars to actually appeal. Lack of time. People don't have the time to do it. And most importantly, lack of expertise. The folks just don't have the expertise in-house in order to handle those. And all this leads to issues with payment and collections. So according from a report from TransUnion, a significant percentage of bills are not getting paid. In fact, the statistics show that 4% of hospital bills that were 3,000 or more, and a whopping 99% of them were not paid in full. So according to Go Practice Blog, patient balances are getting harder to collect. 65% of bad debt belongs to insured patients, and average recovery for medical practice's bad debt is 21%, actually 21.8%. 1 in 5 insured Americans encounter payment problems with respect to medical bills. So what about the providers here? So according to our own Becker's ASC report, for the last several years, ASCs, like nearly all healthcare providers, have witnessed firsthand a growing shift in the responsibility for the payment of services from payers to consumers. There's been numerous obstacles for the delivery of surgical services, including the ability for patients to cover their expenses and surgery centers to collect what they owe to them from performing procedures. There's been a substantial increase in patient responsibility, and at the same time, surgery expenses have grown tremendously. Patients are increasingly forced to bear the cost. According to Instamed, 65% of consumers indicated that they would consider switching healthcare providers for better payment experience. Providers are struggling to address the patient needs with regard to cost expectations. Despite the growing demand from patients for more information about their medical care expenses, providers are coming up short in terms of meeting those needs. Westcorp data indicates that 3 out of 4 patients say they do not know about the cost of their healthcare services until they actually receive the bill. And 30% delay medical payments because of confusion over what expenses were covered by insurance and what they owe. Patients are experiencing significant negative impacts on their health and financial well-being. NORC at the University of Chicago cites that 40% of people skip necessary medical procedures due to cost, and 2 to 4% of patients had a medical bill turned over to collections agencies. 37% of consumers have unpaid debt from medical bills, according to the Federal Reserve. And finally, don't forget how negative billing affects patients. Patients who are very dissatisfied with business office interactions are more likely not to pay their bills willingly, and out-of-pocket cost impacts provider selection. More than 50% of patients indicate that out-of-pocket costs will have a significant or highly significant influence on choice. So put this all together, and what do you have? Well, collections, you need a good collections program to be in a position to take advantage of the opportunities there. I'll turn it over to Pat here to talk about putting together such a strategy and how that works. Pat?
Thanks, John. So first things first, the biggest reason you want to focus your efforts on payer collections is the money. Providers today are collecting less and spending more than they have historically. Denials and underpayments continue to increase. Unpaid claims remain unworked, and there's a lack of visibility into what's driving AR and how to improve future AR performance. Couple that with the fact that it costs 4 times as much to collect from patients as it does from payers, and it becomes very clear that your attention needs to be laser focused on payer collections. So getting started, there are 3 first steps towards maximizing your revenue with payer collections. Number 1 is to use data to figure out where you can improve your collections. The typical providers I talk to just look at the payers, and you really need to dive deeper and look at procedures, the individual provider, even the biller and the collector working the claim. So really dig deep into your data to understand where your shortcomings are coming from. It's also very important to look at your trends over time versus just a single point in time. Any single point in time can be very misleading and won't really show you where your issues lie. Number 2 is identifying where your processes are falling down. So we'll give you areas to look at later on and must-haves, but you have to review every process in detail to identify holes and breakdowns. Number 3 is to evaluate your resources for capacity and expertise. In order to maximize your payer collections, you may need to add capacity to your staff or adjust how and what they're working on. Figure out the strengths and weaknesses of your team, if they have the bandwidth and expertise, and if not, how you can supplement their efforts. So number 1, identifying problem spots by reviewing data. You need to be regularly reviewing your data to spot problem areas in your collections. Every revenue cycle has some areas that perform well, and then some areas that may lag. So you need to proactively identify those lag areas. It's a very crucial part of your collection strategy. So some tips here. First thing is to set a baseline that's based on hard data and not just a feel for what you think or want collections to be. Also, it's good to have different baselines by payer, by procedure type, versus just a flat percentage of collections. For example, Aetna historically may pay you at a 50% of charges, while Blue Cross may only pay at 20%. So you want to know these different baselines so you can really focus your attention when the claims don't hit those baseline numbers. More to the point, you need to pinpoint problem areas by really diving deep into segments rather than looking at it just from a 10,000-foot level. Another thing you want to do is really look at collections as a percentage of billed rather than just total collections in a given period. Collections may ebb and flow month to month if your charges are not steady, so if your charges and procedures are flowing. So if you don't bill it, we always tell clients you can't collect it. Some other ways to slice it are by procedure code, collector working on the claim, level of care. Most important is just to look at things more than just by payer. You want to really make sure you analyze every account to ensure you've maximized your reimbursement. It may seem obvious, but with the complexity of the reimbursement environment as well as billing systems, ensuring that you're touching every claim to verify it's been paid at the correct, appropriate, and most importantly, highest rate is critical to maximizing your reimbursement. So number 2 is evaluating processes. So there's 4 major process areas you can look at to improve your AR collections: coding and billing, correspondence, payment posting and reconciliation, and of course, payer collections. So number 1, coding and billing. With coding and billing, your goal is to have the best clean claims rate that you possibly can. Sending it right the first time increases cash and reduces your time to payment. So if you're going to do coding in-house, it's increasingly necessary to have encoder software. The software is going to have up-to-date codes, allowing you to know what can be billed together, and even specific payer nuances to make sure your claims are clean. It's also extremely necessary to have a claims scrubber to increase the claims acceptance rate. The scrubber does exactly what it sounds like it does. It literally scrubs the claim to make sure it's accepted at the payer and then processed. So it's even nicer in a scrubber to have one you can put your own custom edits in to help the scrubber create cleaner claims. With increasing complexity of claims, billing systems are just not set up to be able to do this all the time in every situation. Coding and billing continue to become more and more complex, and asking your in-house team to remember every rule and every new code is just a recipe for lost revenue. So correspondence. Reviewing, logging, and most importantly, responding to your correspondence is critical to ensure the highest payer collection. The payer is betting on the fact that you will not have the time or expertise to respond timely to all the paper material that they send to you. Some of it might get lost. This is kind of part of their whole plan. Not responding timely is going to cause delays in processing, underpayments, backlogs, rework, and at worst case, flat out denials of your claims. So in the end, you have to have a well-defined plan that includes the following 3 items. First is scanning and logging paper correspondence into the case file it belongs to, not just in a shared folder. Number 2 is communication. So you have to have a process to actually notify the collector working the claim that the correspondence has been uploaded into that claim. It's not a good practice just to expect that they will kind of bump into the correspondence on the Johnson case. That's a recipe for things getting missed. And then lastly is prioritizing the correspondence. So you have to sort it between which ones are notifications versus which ones actually require action to reduce your delays in payments and denials. So now on to payment posting. You need to make sure primarily that your payment posting is up to date. Typically, we like to recommend this is within 48 hours. If not, your team's going to be reworking or performing unnecessary actions on claims that are already finalized. So there may be an account that paid, last week that your collector is calling on today and performing unnecessary action when it really should have already been listed as processed. In the same vein, you need to make sure you're balancing your accounts to 0. If your claim has been paid and processed, you need to get it out of the open AR so people aren't taking unnecessary steps to remedy the situation. And lastly, you need to reconcile. You need to ensure the remit you receive equals a payment in the bank and vice versa. It's bad practice just to post one without having the verification that you have the other. Finally, we get to Payor Collections. So in Payor Collections, the primary key is understanding the importance of timely follow-up. The first step is to analyze the typical time it takes your payers to respond to your claims, and then set up a process to follow up with the payer if you've not heard from them in that time frame. And this means different times for each payer. So Aetna might be 15 to 20 days, Blue Cross might be 50 days, et cetera. You want to have different timelines for each one. This is going to limit unnecessary work and action. So if Aetna typically pays you at 20 days, you don't want to be following up with them on 7 days and 14 days. This is unnecessary action that can be used performing other tasks, making sure you don't create backlogs. Once you set up the process, it's imperative that you actually follow up on time. You need to ensure that the payer has your claim and it's processing. It allows you to handle issues or information requests timely as to not delay payment. And it can help you reduce denials that occur from a lack of response. Once that's done, you want to create workflow rules based on different scenarios to drive the appropriate action on your claim. Make sure you address each claim according to its timeline so you don't miss processing deadlines. You can use calendar reminders or ticklers to set this up. Unfortunately, the typical billing system is primarily set up to bill rather than to collect on claims. So this process becomes much easier if you have a workflow tool, but it's critical regardless. So how to collect unexpected reimbursements. We call this the found money. The first key to this is appealing. You need to make sure you're appealing all underpayments and ensure that all your denials are worked. You should leverage your historic data to negotiate with payers for the highest possible reimbursement. You need to be able to present a compelling case by showing them data that demonstrates that they've paid at a higher rate on previous claims of yours. Next, important to reconcile. Again, understand all your open account balances and have a plan for reconciling them down to 0. You also need to review, research, appeal, and reconcile your outstanding AR to identify potentially collectible accounts and pursue payment or recommend the appropriate closure so you can get to 0 balance quickly and cost effectively. And then lastly, consider outsourcing to a specialist in Payor Collections for cleanup of your correspondence, billing and coding, payment posting, and credit balances to get you caught up so you can pursue your most collectible accounts. So lastly is evaluating your staff. Just as hospitals depend on secondary collection firms to resolve patient bad debt, they're also turning to outsource firms that specialize in payer collections to assist their on-site resources. Outsourced solutions are more and more common and on the rise, particularly when it comes to complex claims and the pace of change in healthcare billing. Leveraging expertise maximizes your chances for significantly improving your bottom line. Based on best practices, you want to take a look at your staff to determine if they have the capacity to improve your collections rate. Some of the key data to evaluate include number of claims processed by collector, your DNFB days, charge and billing lags, collection rates, work and rework rates, any error rates or logs that you keep. The key is to have metrics that you can use to evaluate and then end up holding people accountable. So how can technology and automation help you? Analyzing claims is extremely challenging when you're using your billing system alone or manual approaches. So when you use technology to help, when you use technology to help manage the payer reimbursement process, you're able to do more with less. Automated data analytics allow you to quickly identify and prioritize at-risk accounts before they become a problem. Then you're able to leverage workflow technology to assign a path for each claim, thus ensuring that nothing falls through the cracks or is missed due to oversight. So the first key I want to discuss is bots. Bots are automated agents that actually scan payer websites and automatically update you about the status of a claim. The bots can be set up to feed account statuses back into your system, which eliminates the need to follow up every 7, 10, 14 days, as the bots are continuously pinging payer websites to get you information. This ensures you're going to get statuses before you even receive the 835, making your staff more proactive in working your account. Using bots can ensure your team is making the proper touch at the proper time. There are many vendors out in the space that can help set this up for you. Just keep in mind that you need to ensure the bots are actually driving workflow and not just bringing back data. The second key in using technology is having centralized data. So it's very important to have all of your data in one place, all talking to each other. Everything from your billing system to your clearinghouse, payer websites, workflow tools, everything should be automatically pulled into one place. Having your collectors work out of one primary system with all of the data available to them will streamline the process and their effectiveness. Having data can be very important, but it does little good if you can't access it easily. Think about how much time it would take a collector to go into each one of these individual items and pull this data manually, one claim at a time. So the third way technology and automation can help increase your collections rate is by leveraging workflow automation. Understanding workflow is critical because the most common issues on the back end of collections are actually caused by breakdowns in the early parts of the revenue cycle, like auth denials or incorrect claims data. You need to dissect your workflow and identify weak links on the front end to help increase cash flow and reduce aged AR in the back end. With a workflow tool, you're able to use automation to drive action. So some examples of this are automatic rules to assign follow-up based on sets of criteria, such as the stage of the claim, maybe the time since last follow-up. Other things are, assignment based on task. So claims that need follow-up will go to the follow-up queue. Claims that need documentation will go there. Billing and coding review. It ensures that the best touch for each situation and by the correct person. Lastly, it's kind of timeline-based assignments. With this type of workflow, you're able to ensure that you never miss another deadline again with workflow that's tied to your payer timeline. So, what to do if you don't have automation? At the end of the day, you have to find a solution, whether it's manual or automated, to maximize your collection. So you can use spreadsheets to help you keep track of the assignments, and track updates and resolutions. Just make sure that not only are all the accounts being touched timely, but they're being touched appropriately in the spreadsheet. You also need to use ticklers or calendar reminders to make sure your timelines are met. Not using some sort of reminder is going to end up resulting in leaving money on the table. You also need to log all the actions into your billing system or any other system that you need to track all your information. You need to have detailed notes that describe what action was taken on the account, the next steps necessary, and what the timeline is to perform that information. And then finally, you need to create manual reports to track the productivity, the success rate, and to hold your people accountable. So putting it all together, let's kind of talk about how CollectRx can help you create a successful payer reimbursement program. So succinctly, a payer reimbursement program is simply the strategy, tools, and processes necessary and metrics that ensure you to collect the maximum reimbursements from your payers. There are 4 major components to a robust payer collection strategy that will let you maximize your reimbursement and shift your strategy from patient to payer collections. The first component, billing and coding, allows you to maximize claims revenue, increase total reimbursements, and reduce denials and underpayments by ensuring your claims are coded and submitted correctly. Medical coding is becoming more and more complex, and without the resources that can navigate the industry changes, you run the risk of reduced payments across all payers. You need to focus on increasing your expertise, technology, data, and process to enhance accuracy and efficiency and reduce billing errors and unpaid claims. Major areas we focus on include coding and document review, charge entry and reconciliation, and billing and claims processing. Next, collections. This is really where the heavy lifting comes in with any payer reimbursement program. No matter what your claim type is, you need to be able to work across all payers to ensure that every claim is reviewed, denials and underpayments appealed, and the first and additional payments reconciled to ensure that you're getting all the payments you're entitled to. The goal at this stage are to increase cash collections, automate processes, reduce your AR days, and ensure that each claim is paid at the highest rate. The goal is to get all your claims paid correctly, completely, and on time. The next component is data reporting and analytics. You need to ensure your billing department is data-driven and able to address challenges of the most complex claims. Insist on leveraging data, reporting, and analytics to understand your revenue cycle and provide the right recommendations to help you maximize your collection. We can help you build easy-to-understand, intuitive reports and dashboards that provide real-time window into your billings and ensure you're able to understand your current situation and even a plan for the future. And lastly, complex claims and out-of-network expertise. As the reimbursement environment becomes more challenging, you need to build your expertise in fighting the payers for the reimbursements you deserve. Partner with someone who understands the tactics the payers use to reduce payments to providers and has the tools, technology, processes, and know-how to ensure you receive the reimbursements you're entitled to. And with that, I will hand it back to John.
Thanks, Pat. So in sum, we hope you have a better idea of what's happening today with respect to payer reimbursements and collections. And also you should remember that when done right, proper payer reimbursement management and collections is one of the only ways a provider can improve financial performance. So again, we thank you for attending today, and I hope you found the session useful.
Thank you, John and Pat, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. We've already had several questions come in, so let's go ahead and start with this one. What is the one thing I should be doing right now?
I can take that one. I mean, I would say, in the shortest term, if you want to impact your revenue today, is you have to be actively following up with your payers. So, setting up kind of programs to call on them to ensure they have everything they need to process your claim. Additionally, you want to really look over your last kind of 12 months to see if there's any money kind of left on the table. So underpayments, denials, that type of thing. And then probably in the long run, the biggest thing you can do is, enhancing your data and automation. So you're really investing in kind of the future of your collections.
Great. Thank you for clarifying that and helping out with that question. Another great one that has come in is, what is the biggest mistake that can be made?
Oh, that's a good one. I guess I'd start by saying, don't be penny wise and pound foolish. It's important that you invest in your RCM system, and I'm not saying that cost is never a factor, but when you have something that's working, let it work. You'll do the best by doing it that way. And I guess the other thing is, sometimes providers don't realize that what the payer's true interest is here. They don't want to pay you anything. And I don't care what they say in what kind of setting, their goal is to pay you zero. And a lot of providers don't realize that we're really on the other side of the table, so to speak. You are as the provider, and they want to keep you down at zero.
Great. That's a great point and very helpful. So do either of you have any final thoughts?
No, I mean, I would say that, some of the biggest things are, again, just following up and doing active follow-up on your claims. A lot of times we believe that if we bill it, it'll automatically pay, and that is the case with some claims, but really just, making sure you're actively following up is your best chance of success.
I would just add, and Pat covered this, of course, but with respect to appealing, it's important to take advantage. I know it's expensive. I know there are a lot of things involved with doing that, but in terms of maximizing your reimbursements, and frankly, whether you use us to do that or do that on your own, there's a tremendous opportunity, to really improve your bottom line.
Wonderful. Thank you. I know we're just over the 30 minutes we have slated for this webinar, so I'm glad we could answer a couple questions. I want to thank John and Pat for their excellent presentation and CollectRx for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.